In this video, I will review the normal amount of wet and dirty diapers that you should expect from your infant and the normal changes in poop during the newborn period. Newborns will have a steady increase in wet and dirty diapers as they grow. The first 4 to 5 days of life are equal to the amount of wet diapers that we would expect from your infant. For example, on the first day of life, your infant should have at least 1 wet diaper. On the second day, they should have at least 2 wet diapers, etc. By days 4 to 5, your infant should have at least 6 to 8 wet diapers per day. You should expect about 6 to 8 wet diapers per day as they continue to grow as well. Wet diapers are an essential measurement of successful feeding, so it's important to monitor your infant's wet diapers to ensure proper intake of breast milk or formula. Stools, otherwise known as poop, should increase in quantity and change in color during the newborn period. On day 1, your infant should have at least 1 stool, which will be black or darker in color. This is what we call meconium. The meconium stools look different because they are eliminating the substances from the time spent inside mom's belly. During the next few days, your newborn should have at least 1 stool per day. You will notice these stools start to transition from that dark black sticky consistency to a softer yellow or seedy yellow consistency, with slight differences depending on breast milk or formula intake. By day 4 to 5 and through the first month of life, your infant should continue to poop every day, typically between 1 to 8 times per day. If your infant is breastfed, after about 3 to 4 weeks, they may start to only poop every few days or even up to 1 week, and that's because breast milk is more completely absorbed. This is completely normal. If your infant is formula fed or partially formula fed, continue to expect them to poop once a day. Throughout infancy, stools may vary in appearance from time to time. These stools may vary in color, with shades of yellow, brown, or even green. Notify your child's provider if you notice black stools after the first week of life, red or blood in stools, or if you notice white stools. It's also important to call your infant's provider if you do not see the appropriate amount of wet or dirty diapers, as we previously discussed, because this could potentially mean they're not getting enough breast milk or formula to meet their body's needs. In summary, by day 5, your infant should be peeing at least 6 to 8 times per day and having at least 1 to 8 stools per day, which would have transitioned to more of a yellow appearance. If they are breastfed, after 1 month of age, they may no longer stool every day, and they may go up to 7 days without a stool. But you should continue to see 6 to 8 wet diapers per day. We have now reviewed normal wet and dirty diapers in newborns and infants. Remember, it's important to keep track of your child's wet and dirty diapers so you can ensure that they are drinking enough formula or breast milk. Thanks for watching.